Informed consent is a foundational process in the clinical research field. It's how we, as clinical research coordinators, assess whether a patient is truly understanding what they're getting themselves into. So we'll meet with them one-on-one for about 30 minutes to an hour, and we'll go over the study details, the risks and benefits, the costs, if there are any. We'll make sure the patient knows that it is completely voluntary to do this study. And then at the end, we'll wrap it up and we'll have them sign a form attesting that they understood everything we just said. The problem with this, though, is we don't actually know if the patient understood it or if they're just wanting the treatment or if they're just trying to go about their day. So wouldn't it be nice if there was a questionnaire or a quiz or some other tool that could be used to assess patient comprehension? Well, there are. There are things out there that have been proposed by organizations across the United States that have developed forms of I-consent or consent questionnaires. However, this is a lot to keep up with. The thing that you have to keep in mind is that the informed consent document that is being gone over and signed is typically 20 pages long. These documents are complex. They're easy to read, but they include a lot of information. Furthermore, as a study progresses, you may have amendments to that informed consent. So when the patient comes in next, you have to do it all again. You have to make sure that any changes or new information is being presented to them in a timely fashion. Furthermore, if the patient is not an adult, there's a separate process for assenting minors and for making sure that their parents sign off. So it's a lot of complex documents to keep track of on top of the questionnaire or the quiz that you're trying to implement to test comprehension. So this is where artificial intelligence, which has really boomed over the past couple of years, can really help transform the clinical research enterprise, specifically with regards to informed consent. When I talk about AI, I'm really talking about the large language models presented by companies like OpenAI, which have the ability to read through full documents and make other documents or make judgment calls based on them. So we're presenting what we call patient and protocol specific comprehension questionnaires, or PCQs. These documents are using large language models to digest the information in a protocol. They have parameters that we can tweak based off of the age group or the background of the patient. So they're specific to the patient, and they're generating these questionnaires for us every single time a new informed consent document is released, so that we ensure that we're only using the latest version of the informed consent and that all relevant information up to this point is being presented adequately to the patient. This furthermore helps us make sure we're adhering to the regulations set forth by the Common Rule and the principles set forth by the Belmont Report. Now, it's not just making sure that this is a true informed consent process. That's a big deal. But this also has applications for diseases like dementia and Alzheimer's, where the patient themselves might not be cognitively capable of giving their own consent. And that's really hard to judge. There are some tools for it, but it's typically qualitative and it's a guessing game. These tools can be used to assess whether they can, and if they can't, we can opt for a legally authorized representative. We really hope to see these tools be applied to clinical research sites across the United States to improve our compliance with GCP, but also to make sure that we're only consenting patients that have the ability to do so. Thank you.